I'd like to welcome everybody to this Fireside chat, as it's called. We're just delighted to have Eric Horvitz here. Eric has had a tremendous impact on computing broadly, on AI and data science in particular. He is a technical fellow at Microsoft. He is the chief scientific officer there. Before this, he was running Microsoft research labs, not just the one in Redmond, but all the other labs in a half a dozen other places. His work has spanned many aspects of AI, and he has been recognized with the Feigenbaum Prize, with the Allen Newell Prize. He's been inducted into the Aaai Academy. He is a fellow of the ACM, the AAAI, both the AAASs, and so on. He's a member of the National Academy of Engineering. I should probably stop because I could take up the whole hour talking about Eric's accomplishments. We're just delighted that you're here, Eric. And just to, I guess, get us started, could you tell us what your role as Chief Scientific Officer at Microsoft means? You're the first CSO there, as I understand. And welcome.
Well, thanks, Jag. It's such an honor to be here, and it was an honor to have been invited by you to participate in this symposium. Well, it's interesting to have been named as Microsoft's first Chief Scientific Officer. We haven't had one before, and this comes after my role. And it was quite an intensive experience itself, overseeing a number of our research labs after I spent time as director of what I refer to as Microsoft's main starship, even though we like to celebrate all of our labs with the original Redmond lab, directing that for a number of years. Let me first say that there's a great deal of latitude and freedom and trust I've received from Satya Nadella, Kevin Scott, our CTO, and other leaders in defining the role moving forward. But I've started to flesh out several critical functions. And by the way, as I do this, I've been in touch with some CSOs at other major companies. It's, even finding your peer group is interesting in this situation. But my role is aimed at providing cross-company leadership perspectives. I would put it broadly as out-of-the-box thinking on advances and trends on scientific matters that are, I would say, at the frontier of our understanding. For my role, and given what I've been doing, maybe we'll talk about it a little bit later on responsibility and technology. I'm also very interested in pushing and coordinating on issues around, I'll say opportunities and issues around the intersection of technology, people, and society more broadly, given the footprint of a company like Microsoft these days in the world. And there's some really fast moving and intriguing areas, which a company like Microsoft, as we've grown in terms of our services and our breadth over the years, are going to be really important that might not be exactly where we are now. And this includes some of the areas that we're actually investing heavily in now, like AI, constellation of technologies we call AI, and data sciences more broadly, in terms of thinking outside the box, in terms of where things might be, but on new areas as well, like, for example, biotechnology. It's pretty clear to me that in biotechnology, the world's going to change in this realm, including its implications for material science, for biomedicine, of course, in areas like sustainability, around climate, carbon capture, new kinds of chemistries. There is this interesting interesting opportunity at the intersection of today's computational methods, including advances in AI and biotechnology, which I think we're just scratching the surface of now as a civilization. And this will include new kinds of workloads, new kinds of cloud challenges for cloud computing, client challenges, and so on, that will have big implications for the world of computing, for tools and platforms. So I've been exploring that intensively lately. And then this is interesting notions of what I can do across the company with my knowledge over the years of all the MSR researchers and what they're doing, what they work on when it comes to the frontiers of science and technology, for an opportunities for coordination across the company. Finally, I've been doing lots of external work, so leaning in even harder than I've done in the past into government agencies, civil society. I've been serving on multiple committees. I know many professors at University of Michigan, so UMich, gotta practice that phrase, are involved also in like, for me, the National Institutes of Health, the National Security Commission on AI, the CSTB, National Academies. There's a lot to do and coordinate in my role.
Yeah, and that's a very rich set of things you described, and given the richness of your experiences, I couldn't imagine a better person to be doing this. One of the things that you have is, in addition to a PhD in computer science, you're actually an MD, and you've worked extensively in AI for health. What we do at MIDAS is try to bridge disciplines and bring people together from multiple disciplines. And, we have a strong contingent of people in the health sciences and medicine. And so I thought perhaps we could start off by having you tell us about a project or two that you did in that space.
Yeah, so I've seen AI and data science as, let me just say, I view these two areas, the area broadly of data science, as a sleeping giant for healthcare. We hear a lot about possibilities, and there's been quite a lot done in biomedicine broadly, but that giant is only, I think, first waking up now. I think we're truly at an inflection point. In fact, if you told me back when I was a grad student finishing up in 1990 at Stanford that, as I was so excited about some successes we had, and I'll mention them in a second, that, here's the world of 2020 where we are now, and you showed me today's world, I would be shocked at how slow progress has been. Like, I'd be floored. I've changed fields. So I think things have gone slower than I expected, but I remain very hopeful and excited. Success comes in different ways when it comes to interesting projects and applications. I've always felt that success in part is coming up with new core foundational advances and capabilities. And this comes through sometimes projects and prototypes. For me, one of my formative experiences that I still refer back to in terms of my enthusiasm and excitement was our work on the Pathfinder project, which was one of the major projects I was engaged in and helped to co-found during my dissertation research back at Stanford. And this was to explore the possibility of taking the rising interest in Bayesian networks, or probabilistic graphical models more broadly. I would call it that technology, which is still quite with us and important, but in the mid to late 80s, it was the deep learning of its time. It was the exciting foundation for capturing probabilistic information, reasoning under uncertainty, and performing diagnosis. We basically applied those methods to real world challenges with diagnosing disease from histologic slides, or sort of working in the realm of what's called surgical pathology, which is defined as 40 areas, each representing one of 40 major tissue types in the human body, where there are typically experts and colleges of folks that are just really fabulous at understanding details and nuances of a tissue area. And the basic idea there was there are general pathologists called community pathologists, where your tissue section typically goes when you get a little biopsy of your skin or something more serious. I shouldn't call skin biopsies non-serious. Many people have, can be fatally diagnosed with those illnesses as well if it's a melanoma. But typically those sections go off to a community pathologist. And if they have trouble, the slide is FedExed out to an expert in one of those 40 areas. Well, with the Pathfinder project, it was an NIH funded project to explore the capture of expert knowledge in lymph node histopathology and seeing if we can build a system that would go to expert levels of diagnosis. And we achieved that bar, but we built a system end to end, I and colleagues, that not just did probabilistic diagnosis or diagnosis under uncertainty, for example, providing for any list of features being seen under a slide with a distribution over diseases, called a differential diagnosis in medicine, but also worked through the idea of this loop end to end. What should a system do at any moment? For example, computing the expected value of information to guide and ask for new findings. How do you explain the current inference to a physician? It's one of the earliest pieces of work that I know of on the explanation of probabilistic information to end users. And we grappled with this trade-off between understandability and accuracy of what the system was doing back in the mid 80s. So I thought that was really interesting. Now I should say that what was exciting for me, and I'm not sure if it's a good thing to recommend to students, I, a colleague, and the expert we worked with got so excited about Pathfinder, and you can read about that project online, that we just ran off and started a startup company we called IntelliPath as grad students. And there I was balancing the PhD work, which was fabulous, with running a startup right in the middle of trying to finish a dissertation. And in the end, it was very interesting and illuminating to actually then try to generalize what we had done. We did this crazy thing back in I think it was 88 or so. We moved our Pathfinder system working with the Stanford OTL, the Office of Technology Licensing, off of these gigantic list machines of the day and onto this crazy thing called a PC. And we found that it had the power we needed. So there we were with an Aaai in medicine application running on PCs. And then we built a platform to capture the knowledge of each of 40 teams of experts and sold a system with the help of the American Society of Clinical Pathology, the ASCP, to end users and had experiences in looking at how the system was actually being used. Now, I should say that, again, I don't recommend doing this kind of thing in grad school because it was a world of very, very little sleep and trying to do too many things at once. But that company, IntelliPath, eventually became Knowledge Industries as we generalized to other areas of medicine, as well as to taking the whole system and methodology to other areas like jet engine diagnosis, sitting in United Airlines Maintenance Operations Center in San Francisco, diagnosing jet engines with the same technology we developed for doing pathology. That company, Knowledge Industries, was eventually acquired by Microsoft in 1992, and it brought me to Microsoft. I wasn't planning on staying at Microsoft. Let's give our technology to Microsoft, and then I'm going back to academics. That's my goal. And here I am 27 years later, still at Microsoft, through that interesting path of doing this little startup. I should say that that startup also brought me into close connection with experts around the world in pathology. I remember after ICHCAI 1989, spending a few extra days, which ICHCAI was in Detroit that year. And I drove down to Ann Arbor and spent time at you never forget who you work with, working with Henry Appelman, who is a GI expert at UMich. I believe he's still active, to work on a Bayes net for large intestine, one of the areas. And I also spent time with Sharon Weiss at the time, who was a soft tissue tumor expert on a Bayes net. Had this really interesting memory of sitting with Sharon Weiss at UMich on the floor with a gigantic piece of like butcher paper with a big Bayes net splashed across it as we crawled on the floor looking at nodes and arcs between the nodes. But then there's more, just jumping, you said a couple of systems. More recently, I've had a lot of fun working with modern methods. I'd call them over the last 5 to 10 years on dipping deeply into the messy world of electronic health records and building diagnostic or predictive models. We did one for readmissions prediction. Readmissions, preventable readmissions has been shown to be about a $20 billion cost and opportunity for Medicare reimbursed patients. And we worked at a hospital in Washington, D.C., and did a lot of work on this, bringing up a system that can actually predict at discharge time which patients would bounce back to the hospital within 30 days. This is a penalizable metric for hospitals. The idea of trying to bring up a system, working with the data, going from the academic challenge to a real world running system required really interesting systems challenges, like we had to build up a shadow EHR system that was not interfering with the hospital's daily life. We had to figure out how to bring data and predictions across a wall. We had to deal with HIPAA constraints. But being in the hospital at a real center where we can actually, in the end, bring up a number posted in the electronic health record by a patient's name at discharge time on a probability, and then thinking through what that would mean in terms of decision analysis, the decision-making component, was very, very interesting. I should say it taught us some lessons as well that I didn't expect. For example, we took the same model we built for this large urban hospital called the Washington Hospital Center, a MedStar hospital in DC, and tried to apply it like a few miles away at Union Memorial Hospital, and found that the models we trained on a massive amount of data in a big hospital just fell on their face when applied to a different demographic. And we realized at that time that we had a lot to learn about transfer learning. We had a lot to learn about maybe doing local auto ML at each hospital to build a custom tailored model to the hospital that might have to analyze data over time to stay fresh. And it helped us to actually field a commercial product called the Microsoft Readmissions Manager that did automated ML, building its own model from data at local hospitals around the world. And before I end, I'll give one more example, and this involves another UMich connection. Right around the time we were working with readmissions, I happened to meet a fabulous young researcher, Jenna Weems, who was at MIT at the time, who came to Microsoft to work with me as an intern. And we were very interested in hospital-associated illness for infections or hospital-associated infections. Sometimes these are called, hospital-based infections or hospital-caused infections, but that's not clear where they come from. So we call them nicely hospital-associated infections. And Jenna led an effort working with me using our same platform we had built for readmissions at the same large urban hospital to really explore this area of predicting which patients would become ill with a nasty infection called C. difficile, a diarrheal infection, within 48 hours, for example, or 24 hours. So you have a chance to do triage or what's called antimicrobial stewardship, special drugs to patients at highest risk, and so on, or special isolation programs. It turns out that 1 in 20 hospitalizations are associated with an infection, like a hospital-associated infection. It's considered a $20 billion a year challenge. 5% of these patients die. It's considered in the top 10, hospital-based infections are considered in the top 10 contributors to death in the US. So it's a really interesting and motivating problem. And with Jenna, we just didn't look at just diagnosis, but we faced tantalizing questions about temporal reasoning. How do you reason over time, given a stream of data over time about a patient? The causal modeling about exposure and susceptibility, which are both active in a patient that might lead to different likelihoods of becoming infected. The idea of transferring a model built in one place, this challenge I brought up earlier, to another hospital. And she's continuing the engagement to this day at UMich. And I just was so happy to hear recently from her, we stayed in touch, that she's brought up a system that's live now at a major hospital in Michigan area as she continues this work.
Thank you, Eric. Yeah, I mean, in terms of the arc of health applications, we have to talk about COVID-19 and what's happening these days. As an expert in AI for healthcare, and also as an administrator who has been collaborating with others and helping with broader efforts, I was wondering if you could say a little bit about how you think about this.
Well, my first thought has been that, boy, I thought to myself, or man, or holy cow, it's really good that the pandemic didn't hit any earlier than today. It's so lucky. I would never call a pandemic lucky, but the fact that such a thing can happen and was bound to happen, the fact that the first widespread pandemic in recent years happened now is good news, in that we're at a point in biomedicine where we really can get our eyes onto the actual mechanism of the virus in new ways. We can understand and think about with clarity multiple pathways to coming up with therapies and attacking the virus or bolstering immunity. So it's been great to see all the efforts going on, and as the scientists across the world in biomedicine and epidemiology and policy have gotten together and have thought through multiple directions, even issues around equity and who's getting sick, and understanding that at a time where we're much more sensitive to these issues, to understand that even a pandemic is not pan. It can be focused in certain areas of our society. For example, in the case of SARS coronavirus 2, on frontline workers, people who have challenges with housing, who are at the have risk factors because of long-term disparities with healthcare and with health and wellness. So I've been involved in several ways personally, and I know that my colleagues have as well. I think you've been also, Jag. How could you not focus some attention on this challenge? On one direction, I worked with several colleagues to set up what's called the OSTP, or Office of Science Technology Policy, HPC, High Performance Computing Consortium for COVID-19. And this brought together the leading companies, leading cloud companies, I would say, Amazon, Microsoft, IBM, Google, together with the national laboratories that have big computing resources to apply. And we built a program that involves philanthropic donation of cycles and data sets as needed to support projects with a end-to-end pipeline for proposaling, proposal reviews, and then partitioning out accepted proposals to different companies. And it's been very interesting to see how that's gone. That's given me and others, this gets back to my earlier quest for Microsoft to understand biomedical workloads of the future. But it's given us some interesting sense for the portfolio of what people are doing to address the pandemic and to try to mitigate the effects of the illness or its transmission, where we see proposals coming in that have been accepted on understanding the structure and function of the virus, including understanding the viral proteins at a molecular level, drug discovery, screening and designing new kinds of molecules, small molecules and biologics for therapeutic uses, genomics, understanding the viral genome, including its phylogeny and its mutations, and disease transmission, the epidemiological modeling that we see is being used almost every day in our newspapers now to see where things are going, hopefully down. And so that's been very interesting for us. And then to think about how we've taken that information and also bolstered our own insights as Microsoft in what we're doing. We also have Microsoft, and get a sip of coffee here. We also have Microsoft efforts in this space. For example, and this, it turns out, it's just as a high level comment, many folks, like I'm one of these kinds of people that reach out a lot, that make lots of connections. I love the company of, and the collaborations, even if informal, with many scientists, researchers across the world. At a time like this, we can leverage these connections. So early on, I remember I was giving a talk at AAAS national meeting in Seattle this year, which was in February, I believe, and towards the end of February, if I recall. And I met with a close colleague who was a senior person at CDC. And there was rumblings around the world about the possibility that this virus would go big. And just sitting in the hallway, reflecting about this amidst big crowds in Seattle in February. I remember my keynote there. It was a really fabulous, energetic time where people were important, and I loved the being amidst all my colleagues and others. But we thought with knitted eyebrows about what we might do, and then within like 2.5 weeks or 3 weeks, we were in the middle of a declared pandemic, and I went back to this person and brought Microsoft together with CDC. And we engaged on several important directions directly, including our work on what's called the health bot to help people triage per their symptoms as to what to do next in pursuing healthcare, running the underpinnings of the CDC health bot system that helps kind of reason about, as an agent, giving the ideal advice to folks. Over time, it's been highly used at the CDC and other places. Also working very closely with another Michigan alum, Peter Lee, who was a very close colleague of mine. And I've had the honor to work with him over the years. And he oversees our health incubation efforts, including efforts with adaptive biotechnology on machine learning about T-cell immunity, convalescent plasma program, and other efforts. So it's been very interesting overall to take my own knowledge that comes from my background in dual training in biomedicine and computer science, my knowledge and close association with many colleagues across the world to think through possibilities.
Thank you. I do want to move on to other areas that you worked in.
How could you leave the pandemic so quickly?
But
such an important thing.
There are several people who are asking, what do you see as the barriers to sort of use of AI in the doctor's office? How do you see physicians in everyday settings, as opposed to sort of specialized places where, of course, AI is already being used in the healthcare system? Is this something that you see happening in the foreseeable future?
AI is not a single technology. It's not a blue-green gas that streams out of the vents. For some of the way it's handled in the public press and literature. It's a constellation of many technologies. We use AI to refer to broader and broader sets of technologies, some stemming back to the 1930s, optimization and planning technologies and so on. So AI broadly, computer science, has so much to offer medicine, from the big hospitals to the specialty areas to the potentially more boutique, even though important areas of drug discovery and pharma and so on, into the world of daily life, of the daily physician's office, the family doctor, in numerous ways. You know, I'm just thinking about some applications over the years that we've worked on, and that I'm tracking now with some colleagues. So, for example, colleagues at University of Washington, where I'm an affiliate professor, in search and retrieval and meta-analysis, for example. There's really interesting work going on. I'm referring to some work by Byron Wallace at Northeastern University and others, work at the Allen AI Institute, where I sit on the scientific advisory board, on really thinking through what it might mean someday to automate the evaluation of the quality of findings in literature, and to help pull together meta-analyses to integrate the results being found in multiple studies to help people with diagnosis and therapy. The idea of automatically helping family docs stay at the top of their game, to stay knowledgeable, to be able to look up very quickly and understand the specialized need of a particular patient or family, is going to be more and more important. I remember hearing from a senior physician at Stanford that these days, so someone working in the emergency room, he said these days when a patient comes in with their family, let's say a patient with a chronic disease, you can just assume that the family knows at the get-go as much as the doctor about the illness and how to best treat it because of all the information out there. The idea is to allow physicians and experts to work with these people, but to even be more of an integrator, to know the frontiers, to know directions, to continue to be a guide and sage when it comes to being a point of care. And one way to do this is to use machine learning and decision-making to automatically help with retrieval and integration of multiple findings and the late-breaking findings and their veracity. If you look at the curated efforts right now, for example, the Cochrane Reports, which your doctors might be using behind the scenes or as you sit with them, these are large-scale efforts to bring together expert panels to basically identify key questions without clear answers and to continue to update what's the best approach forward for a particular syndrome or what's the efficacy of a particular therapy. And more we're seeing AI methods creeping into helping with the automated meta-analysis, the automated synthesis of the cascading frontier, the crashing wave of what we know, and helping also to navigate through all the misinformation and studies that might be, not have the right evidential support, even if they're celebrated. I think it's going to be an important task for managing the complexity of information over time for AI. And I can mention many other areas, but I just went in that way right now. But I think that those tools will not just help, of course, physicians, but also patients and their families.
Great. And actually, this is a great segue to something that you've worked extensively on, which is how AI systems and humans work together. You've been a thought leader in mixed initiative systems. And I guess, people talk about sort of artificially enhanced intelligence or, a good symbiotic relationship between humans using AI to improve their capabilities and do better. I was wondering if you have thoughts in that direction that you'd like to share.
Yeah, this is a really exciting area for me, in that it gets at an area of one of my interests for many years, the foundations of human intellect. I mean, I went into AI because of my fundamental curiosity about our own minds. And so I've kept my eye on the ball of cognitive psychology and cognitive science, a closely related area, over the years, and that literature, for many reasons, including trying to understand the foundations and principles of AI, for example, models of bounded rationality, systems that can't do everything. What do they do? And there's a whole analog to what humans do when they're pressed to act or decide or infer. But this area of human and machine brings up this really interesting possibility of not just having machines that do a specific task, like do diagnosis, and humans use them like a tool, but thinking about AI and humans as two sources of intellect that are different, distinct, and that might be designed to be complementary. And so two directions come to mind that are very closely related. One, if you have a system that can do certain things and come forward at certain times, can you have a mix of intellectual initiatives as a conversation about a problem, a back and forth, an elegant dance, a fluid tango, where a machine and a human are working together, for a better word, as close collaborators in a fluid manner. And I call this work, sort of engaging in a mix of initiatives, and we look for principles or foundations of mixed initiative interaction to make the parts contribute to a greater whole. And a related notion is, I'd like to use the phrase augmented cognition, which is, if we really understand the terrain of the borders of human intellect, and cognitive psychology, and now it's being super powered by data science, has been for over 100 years helping us to characterize that terrain in areas like judgment, visualization, this whole area of learning and retention, education, the ability to deal with multiple tasks at any one time, and distraction. Attention is the area there. Can we actually use knowledge there, or grow that knowledge in a way that will help us focus and design AI systems to explicitly fill those gaps and bring the border of intellect forward, where we enhance the intelligence of people directly, where humans are at the center? And we've done many projects in this space over the years that probe this both mix of initiatives and augmented cognition in different ways. Now, recently, we've in the world of deep neural networks, the variant or the direction in this space with deep neural networks has been, working with interns and colleagues, has been to answer questions like, can we optimize per objective functions a neural network, a DNN, such that it's built directly to work with human beings in terms of how we even optimize the parameters? And so in recent work with Brian Wilder, now at Harvard, and Ajay Kumar, being published at the forthcoming Aaai, we showed how we can directly optimize a neural network to work with humans, ideally, to fill the blind spots and to put its effort into places where humans would not be good, rather than try to replicate humans. So if you look at the idea of building a machine learned model as the possibility of putting effort in different places to make it better at task, A through M versus N through Z, we'd like to actually put the effort of the machine learning and how data is leveraged for machine learning at places where humans just aren't as good, saving that effort or say concentrating it there versus at places where humans are good, and designing systems end to end at the core foundations of optimization for working with people.
Yeah, in terms of working with people, you've also been thinking about how AI, specifically computing systems more broadly, affect humans and society. Today, of course, this is front page news and everybody is talking about it. But as far back as 2008, when you were president of AAAI, you put together an effort to think about it. You convened a workshop, and what were you thinking then? How have things evolved since then? Is where we are today sort of what you were thinking then, or have things diverged? And can you tell us about what drove you to follow this path so much before everyone else?
Well, I've always personally been extremely interested in the social and societal influences of technology. I've studied this over the years with multiple technologies. There's a fascinating story about how electricity or the telephone or radio change things in a fundamental way in how society works. We talk a lot these days about, the influence of social networks and these new applications that are running on supercomputers that sit in people's pockets. But think about radio or telephone. Those were incredible jumps in connectivity and how information is diffused back in the day. I've been very interested in the influences of technologies that are edging into the realm of human intellect. And what I mean by that is, for the first time in human civilization, technologies that in a deep way are moving into realms in a relatively quick way on a civilization time scale, into places that have been the total domain or have been the provenance of human beings, have been the decision makers and the perceivers and the inferers. I remember back to Pathfinder, I got so excited about this idea of there being a way to better explain the value of information computations that went on behind the recommendation to a pathologist to look and tell the system about this particular histologic feature, where the way to do it properly, mathematically correct, in those days using relative entropy, was opaque to physicians, but you could slow it down and reason about groups versus single diseases, and all of a sudden they understood it, but it wasn't as powerful. I said, wow, there's an interesting connection to society and understandability here. So when it came to being AAAI president, I made the theme of my presidency AI in the open world. That had two pillars. And in my presidential lecture, which is online, I talked about we needed to build systems that when we understand what happened, we took them out of the laboratory as we saw more and more of this work. And look at that year, 2008. It was around the same time as we were doing readmissions manager for the first time and commercializing that technology. But taking these systems out of the laboratory and throwing them into the complexity of the open world, all sorts of findings were showing that we didn't really understand the open world, and neither did our systems. They were as, in quotes, shocked as we were about what would happen, given that there were small representations, they were trained on limited data, and now they're dealing with the open world where distributions are shifting, where new demographics, for example, for healthcare, but in other ways, lots of blind spots that we didn't recognize, for example, in high stakes decision-making. Challenge problems were showing up because the world is so much more complex than the researchers or even the experts advising those projects understood. So I proposed and showed examples in my presidential lecture of how we could extend systems to make them more humble and aware that they were indeed limited in a larger complex world. And I talked about technologies along those ways. On the second pillar, I said we need to better understand, and it's related, of course, to the first, for competency and capability. We need to understand the influence of these technologies broadly, and we can't sort of necessarily understand them in advance. We need to put special focus of attention on a number of areas. And so what we did was we kicked off in the fall of 2008 what we called the AAAI Presidential Panel on AI Futures. And what I did was I got, at the time, and you can go online and see who was there, but I asked folks, I invited folks who I thought would be the best minds of our time, folks who knew technology, who were passionate about AI, but who also were caring folks who would be great in thinking through implications for society. And we set up 3 working groups. One was called, the team focused on short-term disruptions, thought like maybe 5 to 10 years out. We had long-term concerns. You could imagine that would include everything from whole major shifts in how society works based on AI advances to concerns about loss of control of machines that we hear from some folks, runaway intelligences in different areas, singularity. And then a third group was, I asked to focus intensively on legal and ethical concerns. And what was really interesting, and we all met at Asilomar, I did that, we arranged to be at Asilomar for symbolic reasons, given the biology meeting, molecular biology meeting at Asilomar on recombinant DNA decades earlier. We met for 3 days and we had our briefings, it was illuminating at the time. Many ideas that are being discussed now much more broadly were touched on at the meeting. It seemed a bit crazy at the time, a little bit. We were out there. We debriefed the community at a panel at Aaai in 2009 in the summer. And I remember some people coming up to me saying, Eric, like, what are you thinking exactly? Like, why is this a big concern? We can't even get these systems to work yet, let alone worrying about, their implications. But I think we were like, if anything, a bit too late. And it's been fabulous to see the rise of interest, both on the social science side as well as on the technical side in the last 10 to 12 years, as we face issues like bias, inclusiveness, transparency of reasoning, the whole idea of safety and reliability of these systems, especially in high stakes applications, the human AI collaboration issues, the issues of equity, and even potentially these potential destabilizing influences of these technologies in military settings that are coming to the fore now.
Right, and I guess with these things at the fore, you've of course been involved with many other efforts to try to manage how these things are done and to try to steer them towards good and avoid some of the harms. So, in particular, there's the partnership for AI that you've set up in collaboration with a few other leading technology companies. At Microsoft itself, you have this thing called the Aether Committee. How do you see these efforts working? I assume there's some things they do well and others that they're not well suited for. Like to get your insights.
Yeah, so I felt deep responsibility in being one of the folks, along with colleagues early on, who were thinking about these issues and now watching the trajectory where they're becoming more and more important, to be involved on and explore multiple fronts for how we might best execute on policies, technologies, and their admixture on the way to a better future where we can really garner the incredible gains that AI technologies can provide society while avoiding rough edges and downsides. That's kind of my kind of passion right now. And I felt like I have to take a chunk of my time out of my pie chart to apply to this space. So I've explored this and organizations and structures and technical directions in multiple ways. As you say, one has been thinking through, look, what do we do as a company? How can a large company or a small company, whether it's or an organization, it could be nonprofit, what do we do? What's the best approach forward? How do we share our insights and ideas with other similar motivated organizations? So at Microsoft, 4 or 5 years ago, actually 2016, coming on 5 years ago, I worked with Brad Smith, who is our chief legal counsel, in discussions about our need to set up some kind of a board that would and process that would pull intellect across the company, also track the outside world, and help us to understand the concerning issues, rough edges, and best practices and policies when it came to our technologies, whether they be on the client side or in the cloud, whether it be in our standard products or in our custom engineering work we do with partners. And we set up what's called the Ether Committee, where I asked the senior divisional leads from all of our divisions to provide me with a lead person who might sit with us on a committee. And then we set up 6 working groups that aligned to what we came to be Microsoft's AI principles over time. We have 6 principles we list on our website now. But the idea here was to think through, in a working group, can we make these groups cauldrons of creativity and focal points across Microsoft research, our legal team, our experts in our product teams, to reason about, for example, privacy, security, fairness and inclusiveness, transparency, reliability and safety, human AI collaboration. And then we set up a very important panel we call the sensitive uses panel, and a process and trainings for the whole company as to when to submit concerning technologies under development or being fielded that raise concerns about that actually hit or triggered a sensitive uses review based on published principles of what we call sensitive and how we define that at Microsoft. And we had immediately a queue, a pipeline of sensitive technologies and a deliberation process with the output of that process could lead to a gating of technology, a saying no to certain work, coming up with precedent and principles where Microsoft would write down, we don't do this kind of thing and here's why, or you can use this technology in this contract work, but you can't do X, Y, and Z. It's been fascinating to see the leadership across the company. And I like to say that Satya Nadella, up to the CEO of the company, has our backs on this, where fairness is critical to us. We say we don't care about profit if it comes to if we're going to be used to distributing technologies that are not fair, and we mean it. It's there's all this question I see about companies. Do they really mean ethics, or is it ethics washing? There's different phrases about this, and I can tell you that at Microsoft, this cuts deep, and we mean it, down to what we will do and what we will not do. And the process has been refined over the years. So right now, we now have Ether continues with top-notch people in each of these committees, and you can see the outputs. There's an intern program. We have a responsible AI standard now that matches our privacy standard for what you have to do when you're working with AI technologies in terms of documentation, tracking, review processes. we have a new Office of Responsible AI on our legal front now that we work closely with as Ether Committee. By the way, Ether stands for AI, Ethics, and Effects in Engineering and Research. And that's Ether right now, and I can talk more about that, but I wanted to mention briefly the partnership on AI, which you brought up. If you don't mind, I'll just spend a few moments on that. And this was the idea of bringing together, the opportunity to bring together all the big companies to provide an opening for other companies, smaller, including startups, to join, but to bring on civil society organizations and nonprofit AI research to build a consortium that would be directed by a balanced board of nonprofit and for-profit, and to really, on the for-profit side, for the founded companies, bring together Apple, Amazon, Microsoft, Facebook, IBM, some of the bigger companies as founding members of the effort. And the heartening thing is that this partnership, this consortium aimed at best practices and research and sharing core ideas about the AI, future of AI, this partnership really was founded by concerned AI scientists, initially at the big companies, who knew each other as grad students, who came together and then worked with our colleagues in the nonprofit sector and civil society to bring together this organization.
Yeah, I guess just moving on, you've also established a 100-year study of AI, and it's hard enough to predict where AI is going, or any field in a decade. So could you say a little bit about that?
Sure. So 5 years after the 2009 meeting at Asilomar that I discussed earlier, I thought to myself, boy, a lot has happened in 5 years, and a lot, including surprises. And if you think about it, 2009, we talked at the Asilomar meeting about potential surprises. And I remember Andrew Ng and Tom Dean, who was at Google at the time, I asked them to kick off the meeting by predicting surprises in AI and disruptions in the short term. And they both alluded to deep learning before it really blasted onto the scene, which really was that summer at a workshop, starting with speech and then image analysis. But by 2014, we were in a different world. And so I thought, wouldn't it be nice to do this again, to have another Asilomar study, a workshop? Then I thought, N gets N+1 induction. We should do this every 5 years. That's a good pulse. And we should bring together the best experts in the world, technical, and in the social sciences. That's also technical, of course, but different disciplines. Bring people together to think through and come up with advice and guidance and predictions to help different sectors, decision makers in different sectors, government, academia, industry, and so on. And so we decided, my wife and I had a long discussion, and we said, let's endow this study so it goes on not for 100 years, but forever. For as long as Stanford exists, the endowment says every 5 years, there's a process of bringing people together, thinking, doing a report. That's kind of akin to what we did for AAAI when I was president, but have this go on forever. And here I am, thinking through, not sure how long I will live, but the idea that there will be a report in 2036, and just asking ourselves, what will that report say about what we do next and what's the status and where do we go, is heartening to me because it's adding a level of reflection onto the world that helps us pause, take a deep breath on a 5-year heartbeat, and come together to make sure, to ensure the technology, data science more broadly, AI particularly, these technologies edge into human intellect, goes well for humanity.
Thank you. We are at the end of our hour. There are so many things that I wanted to ask you about, but you've given us much to think about. If there's anything in closing that you'd like to say, please do.
Oh, just that I know we were going to talk a little bit in our pre-session meeting about industry and academia and the relationship, many topics, as you say. I just love the idea of working with students on the next generation and with colleagues to help prepare the next generation. Just like the 100-year study goes on every 5 years, we need to always be educating the next wave of leadership. And it's been so heartening over the years to work with fabulous interns and students at universities. So I want to just congratulate you, Jag, for running this symposium and for your leadership in data sciences and other colleagues at Michigan. It's great to stay in touch with the school and with all that you're doing.
Thank you very much for taking the time to be with us, and you've given people a lot of things to think about, and I'm sure we'll be discussing many of the things that you've said in the coming days. And this is the formal closing of our symposium. We will have a networking session beginning in about 10 minutes. So go grab your coffee, and then we can sit around and chat about the things that Eric's told us and other things that you might have heard in the day and a half. So thank you all.
Thanks,
and thank you, Eric. Bye-bye.